Live from the heart of the Lowcountry, this is News 2 Midday.
All right, when we come back, we'll check in with a nurse practitioner to find out how you can improve your health. Stay with us. You're watching My News 2. Welcome back. Women's health needs change as they move through different stages of life. So what you need to do to stay healthy in your 20s is different for your 30s, 40s, and beyond. Earlier this week, Tara Lynn spoke with a nurse practitioner about how women can take charge of their own health.
Nurse practitioner Barb Dehn joins us now to explain what we need to do to stay healthy and stave off some health problems. Good morning, Barb. Thanks for being with us.
Good morning, Tara. It's great to be here.
Now, you are a nurse practitioner. Tell me exactly what you do and why that job is becoming increasingly more important to patients.
Well, nurse practitioners examine, diagnose, and treat millions of Americans in lots of different places like hospitals, clinics, even schools. And we are all about health and wellness.
Now, I know you focus a lot on women and helping them improve their health, written some books as well, received a lot of honors. What do you think? Of course, I know mostly women are usually the caretaker in the family, and they take care of themselves last. What do you think is maybe one of the most common mislooked or overlooked aspects when it comes to women's health and women taking care of themselves?
Well, I'm glad you asked. You know, it may surprise you to learn that less than 10% of American women are getting enough calcium in their diet. So it's never too early to start. You know, we want to make sure our teens are building good, strong, healthy bones. So aim for 4 servings of low-fat dairy every single day. And if you're not able to do that, like a lot of people, consider taking a calcium supplement with vitamin D.
And does that become more important after menopause?
Boy, it sure does, because women need to keep their bones strong and healthy throughout their life, and they want to prevent osteoporosis or prevent fracture. So as we get older, we also need our calcium and vitamin D. But you know what? It's not just one thing. We all need a healthy, balanced diet.
Now, and how important of a role does exercise as well as rest come into play here? Is it more important to get that exercise or that day, or is it more important to get 8 hours of sleep? How do you find that right balance?
That's a great question. Patients are always asking me that. And I have to say, as women, we're all so busy. And I want to ask people, please make some time for yourself and focus on your health. There are 3 pillars of health. It's a healthy, balanced diet, it's vitamins and other supplements, and exercise. And if we had to add a 4th, it would also be sleep. And what anyone can do is go to lifesupplemented.org, take the My Wellness scorecard, and find out how you're doing against those 3 pillars of health. It will also give you some simple steps you can take to improve your overall wellness.
Absolutely, because a lot of times it comes down to really getting all of those nutrients. Of course, you can take the multivitamins, but it's usually better if we can get those through actual fruits and veggies and natural foods, right?
Oh, I completely agree. As a mom and a nurse, I'm all about food first. A healthy, balanced diet is really the best way to stay healthy. But I also have to be realistic. It's very difficult to get 5 servings of fruits and vegetables every single day. And I have a teenager, and it's difficult to get him to eat 2 servings of fatty fish every week. So I take a multivitamin, calcium, and omega-3 fish oil, but I also put those on the counter for my 14-year-old and for my husband.
And tell me about the fish oils, because I know I have a lot of friends that try that. I was looking into that. What specifically does that do for us? And I've also heard it can kind of help with your brain power.
Well, omega-3 fish oil capsules have been shown in lots of research to help protect our hearts, but also pregnant women take them to help with their baby's brain and eye development. We also recommend it for women who are nursing their babies, because we've seen that these omega-3 fatty acids are very beneficial in lots of areas for our whole body.
Absolutely, and it's that good healthy fat that we need. So nurse practitioner Barb Dehn, thank you so much for being with us.
It was great to be with you, Tara. Take care and be well.
Thank you.
And that's all the time we have. We'll see you back here at 11 on Monday.